we're going to talk about fillers and a little bit of wrinkling now. The one we use most often is not collagen anymore, but Restylane. There are about 20 fillers out there, 20 different types. Each one touted to be the best. New ones keep coming out to compete with the other ones. They're basically a few classes of them. Within their same class, they're all really all the same. No one's really much better than the other. Some last longer than others. Some are said to be permanent, for example, like silicone and silicone beads. You inject silicone into the skin, which has become recently FDA approved for treatments in the eye, and we've used it. I've used it even it was actually a doctor that I used it in the skin. But this is a hyaluronic acid, which is something we naturally have in the skin, and you can focus on over here and over here. See how it got filled in right over here, and her lips as well, right there. That's one before and after, and then I had to cover up the name over here. Here's when the vertical lip lines over here, you can see before and after. To do that again, see that? These are really hard to treat. Sometimes we do a little bit of Botox in combination with the Restylane, which is a filler substance. If you wake up in the morning, just look in the mirror and don't move. The wrinkles that you see are the wrinkles at rest, which is why they call this Restylane. And for the wrinkles at rest, we have to fill them up. For the wrinkles of motion, those are the ones we use Botox for. Okay, and I'll give you examples like the gallbladder wrinkles exactly. Like the ones in here, over here, or forehead, or ones around the eyes. We just did one just before we started over here around the eyes. And I'll show you before and after of those as well. So Botox, very, very popular. Muscle relaxer for wrinkles of expression. It's been used for more than 20 years. Lasts 3 months to 1 year depending on what we're using, and it's also used for excess sweating. People sweat too much in the armpits or in their palms. We'll put in Botox to stop the nerves that are stimulating all that sweating, and people come every 6, 9, or some people get a whole year's worth out of it. Pilots, people that work in construction, people that really need to use their hands for very precise work in devices, we've been able to help them with the Botox. So here's a little before. Well, yeah, I mean, she has a really phenomenal amount of muscle strength and wrinkling over here. You see this over here, you see this one. It goes all the way up to the middle of her forehead, this little one over here. And we hit it in 1, 2, 3, 4, 5 spots. You see right there? And that's the result. And even this over here, it'll stretch out a little more so that that middle one over there will disappear and stretch out as well. Let me just show you the before again. And there's your after. Really quite dramatic. People really like it. Here's one on the forehead, here's a before, and here's what he's able to do with movement beforehand. You'll ask him, can you wrinkle your forehead? You'll wrinkle it up like this, and then after, much more smooth. And then with about a month later also he'll get a little more of an effect. So here's one smiling of the before around the eyes,
wow.
And there's an after. You know, no matter how hard she tries, she can smile. I mean, it's not going to inhibit your smile, but she won't wrinkle to that extent. Thread lift was popular for a while, where they put threads, you know, under your skin and prop up your cheeks. So all kind of like a facelift with threads. Well, a year, 2 years later, it comes back and it sags. Thermage. Somebody just today asked me about Thermage. Dr. Levy, do you do Thermage? Do you have the Thermage machine? It hurts a lot. It works for a month, and then your skin temporarily is tighter, but it really doesn't have a long-lasting effect, which is why we don't offer it. And here's what we do for people who sweat too much in their armpit. Little bits of little doses of Botox all the way up and down in the hair-bearing area where the sweat glands hang out right in the hair. And it's good for 6 months, 9 months, 12 months. People have different amount of sensitivities. And sometimes the insurance approves this, sometimes they don't. But we do offer it in the office. Thank you all for coming. I look forward to all your questions and to speak to you individually and meet you. Thank you. Thank you very much.
Thank you.